going to be performing a neurological assessment. A neurological assessment is heavily based when you're interviewing your patient and also involves direct and indirect questions. So a neuroassessment begins when your patient first walks into the room. Automatically you can tell what their level of consciousness is, their overall demeanor. So to determine alertness, you are going to come into the room, and if a patient has opened eyes, they're considered to have spontaneous eye movement. If they don't, and you walk in and you have to call their name a couple times, then they're only reacting to your voice. And then if you go in and you do say their name, they still don't answer and you have to go and physically shake them, then they're obviously not alert. Supplies needed are a pen light, an alcohol swab, a cotton dipped applicator, a reflex hammer, a Snellen chart if available. So for the first assessment, it's a mental assessment. So you're going to want to do level of consciousness. That means that you base your patient's consciousness based on normal, confused, delirious, if they're comatose, stuporous. So my patient is awake, so she is normal. You're then going to do the Glasgow Coma Scale rating. You're not going to do this all at once. You're going to basically figure out each of the assessments as you're going through your entire neurological assessment. You're going to look for eye-opening, vocalization, and then motor response. Again, most of that information is obtained throughout your assessment, not just all at once. So the first thing I'm going to do is orientation. So I'm going to make sure that my patient is oriented ×3, which means they're oriented to person, place, and time. So first I'm going to perform hand hygiene. Introduce myself to the patient. Hi, I'm Megan. I'm going to be your nurse today.
Hi, Megan.
What's your name?
Stephanie.
Okay, so I'm just going to ask you some basic questions.
Okay.
So can you tell me your name?
Stephanie.
Can you tell me your date of birth?
9/23/92.
And where are you right now?
In the doctor's office.
Okay, and what year is it?
2020.
Okay, can you tell me what month it is?
It's October.
Okay. You want to make sure not to ask the actual date, as a lot of people are confused about that. And then you're also then going to assess their situation. So, what brings you into the hospital today? And they would answer. This also helps to assess any recent memories. So if they can't tell you the time, they can't tell you their name, that's obviously an indicator that something is wrong. You're then going to want to do thought processes and attention span. So are they following your line of questioning? Are they answering in a correct way? Are their responses scattered, or are they put together? So you're then going to go through a logical thought process. You're going to ask them things that they should know. So how do you make water boil?
You put it on the stove.
Okay, and does a rock float in water?
No.
Okay. And then you're going to ask them memory and judgment questions. So you would ask, again, common knowledge such as the water boiling. You could ask, what are the 4 seasons of the year?
Spring, fall, autumn, and summer.
Yes. And then you also want to ask them any personal remote memories. So what their birthday is, when their kids' birthdays are, etc. And then you're going to want to do an overall assessment on judgment. Are they making safe decisions when they're in the hospital, or do they seem unsafe? And then you're also going to want to ask if they're having any destructive thoughts. So have you thought about hurting yourself or anyone else recently?
No.
Okay. And then you're going to do cranial nerve testing. So can you smile for me? You're going to notice symmetry. Can you stick out your tongue? Can you move it side to side? Can you open your eyes? Close them. Reopen them again. Okay. And then you're going to do sensory reflexes. So I'm going to use a cotton applicator because I don't have a dull and sharp pen. So can I see your arm? So this is the sharp side, and this is the dull side. So can you go ahead and close your eyes? And just tell me if you feel sharp or dull.
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp.
Okay? And then I'm going to do the Babinski reflex. So I'm basically going to take my cotton dipped applicator on the bottom of her foot, and her toes should curl. If they flex out, that means that she's positive for the Babinski sign. So can Can I see your foot? And toes curled. And then you're going to do balance coordination. So you're going to assess gait. So can I have you stand up? And can I have you walk about 5 steps that way? Turn around and walk back. Okay, perfect. Gait is normal. And then I'm going to do the Romberg test. So I'm going to have you come towards me, turn around, and you're going to want to do this for about 20 seconds. So go ahead and close your eyes. And some swaying is normal, but they shouldn't sway too much. You always want to be here for your patient in case they do fall backwards or... Okay, that's good. You can go ahead and sit down. And then you're going to want to do the finger to nose test. So basically I'm going to put my finger out. You're going to touch my finger with your finger and then touch your nose. You're going to want to do this in approximately 5 to 6 areas. Okay. And again, that should be very effortless. You know, they should be able to easily locate your finger in their nose. And then you're going to want to have them repeat it with their opposite hand. Okay. And then you're going to want to do an assessment of Pearl. So that means that their pupils are going to be equal, round, and reactive to light. So you're going to use your pen light for this. So pupils are equal, round, and reactive to light. There are many things that could be barriers to this assessment. Sometimes you're going to need to do alternative assessments if your patient is unable to fully do something. And the purpose is just to make sure that neurologically your patient is